"You're complicated," he said as he stared at his chart and quickly glanced at the time. "If you had cancer, we would be in a much better place. I would know how to help you. But as it stands, it looks like you've tried every procedure and all the medications for your pelvic pain, and still you're not experiencing relief. How is your anxiety? Any thoughts of suicide?" he asked. I looked at my doctor's vacant stare. I haven't contemplated suicide, I thought, but at this moment, I'm strongly considering murder. This was my experience, doctor after doctor, year after year. I couldn't urinate without excruciating pain. It hurt to walk, to sit, to have sex. It started when I was pregnant in 2004 and became worse over the next 20 years. Gynecologists tried every manner of injection, but my OB told me that what I really needed was a good, stiff drink. I later learned, thanks to the internet, that I should actually be seeing a urologist, but they never stuck around long enough to listen to my story. They wanted to poke and prod, and when there was blood and infection, they responded with antibiotics and their voicemail. I had MRIs, I had scans, but for some reason, when doctors reviewed these scans, they decided that the hernia captured in the scan couldn't be the culprit. In fact, it didn't occur to them that I should be notified of this at all. So I internalized this prejudice and told myself, well, it must be in my head. I walked faster, I lifted heavier weights, I stretched further, and I began psychotherapy. How could there be no explanation? Was I losing my mind? By 2016, I was in the hospital with never-ending pattern of muscle spasms after every urination. I screamed in agony and I begged for painkillers. My MRI showed that I had an inguinal hernia. I guess the doctors decided that it was too small or unimportant to mention. I wonder if it's because they had not learned of an inguinal hernia with this symptomology. So the only conclusion was that I was crazy. But I had mentioned that it was hard to walk, that it hurt to bend, that it hurt to lift heavy objects. It's true that the pain registered as burning in my pelvis. But did that have to mean that childbirth was entirely to blame? Does burning in your lady parts mean that you can't have an actual injury? I often wonder why the doctors weren't more curious about whether I might have had an injury or structural issue. Part of my problem may have been that I was not seeing the right doctor. Because of where the pain was registering, the gynecologists and urologists I saw did not consider any diagnosis that might have been outside of their specialty. My experience had been that when I would speak about all the different complaints I had, it would take just a few seconds and then the doctor's eyes would just glaze over. I could see them start to check out. I don't blame them. Modern medicine has only recently begun to understand that women are not just little men. Most of my doctors went through medical school when it was common to label a patient like myself a WW, whiny woman. So what motivation did they have to stay engaged and to try and figure out this complex set of issues? My husband and I started to work together to try and see if we could get the information across in the most organized and succinct way. We knew that would be our only chance of keeping the doctors in the game. Most of the time, my husband would speak first to the doctor, even though it was about my experience, because we learned that over time, if a man would share, they would be more likely to listen. My husband didn't want to see it, but over time, there was no denying it. This past summer, I decided to take my daughter to Italy to spend some quality time with her before she went off to college. The beginning of the trip was magical. I was able to do some walking, climb stairs, and even dance. But on day 12, after climbing what was to be my last stair for a very long time, something went terribly wrong, and my pain shot through the roof. I was in a very acute state for some time. My doctors simply responded by adding more medication to the mix. It was at that point that I decided to make an appointment to see my friend, Dr. David Josephson, who's a urologist. He had been a buddy of mine from high school, and even though I swore that I wasn't going to have him as my urologist, because who wants to have an old friend shine a light on your lady parts? I was literally crawling and I needed help. I sent every single pertinent medical record from the past 20 years to Dr. Josephson. And unlike other doctors I had seen, he read through them all. When I went into his office, he looked at me and he said, "Something else must be going on here. You've identified all these conditions, and even though you're taking all the right medications and you've done all the right procedures, you've not experienced much relief." Wow, I thought. Not a single doctor to date had actually asked themselves, what else might be going on here? Each and every one of them just assumed it must have been in my head instead. Dr. Josephson recommended I rule out issues like an entrapped nerve, bladder diverticulum, and even a hernia. Hernia, I said, isn't that what men who lift heavy weights get? Yes, he said, and lots of other people get them too. So off I went to Dr. Tofai. It was at that point that my story of unexplained pain finally took a turn for the better. Dr. Tofai asked me a lot of questions, and she listened to my answers. She took the initiative to look back at old MRIs and found what looked like a small hernia. She reached out to Dr. Josephson and to a pelvic floor surgeon in Arizona to make sure she was including all my issues and understanding my condition beyond just her area of specialty. The consensus was to have me do a hernia workup, so that was my next step. The MRI revealed a hernia, and although it was small, Dr. Tofai did not dismiss it and assumed that what we know about a hernia of that size, mainly the fact that it was not likely to cause that much pain in a man, was not the entire story for me. After having spent some time discussing my case with my other doctors, Dr. Tofai knew that surgery might have some complications. Namely, my pelvic floor muscles might fight back and contract even more. She took the time to both better understand how to minimize this risk and how to talk to me about what I could expect. I'll never forget the feeling of sitting to urinate a day, a week, a month after my procedure. That mind-numbing pain that I used to feel like my brain was being electrocuted was gone. I can't convey the extent of my gratitude. Next time a woman presents with a complex set of issues that may seem to defy logic, please don't shut her out or refuse to look beyond the narrow prism of your specialty. Take a moment. Consider what you might be missing. Take the time to consult with her other doctors. Make yours the final stop of her doctor roadshow. Thank you.